If you're new here, this is the Med Matrix podcast where we go live multiple times a week talking about everything health related, functional medicine, how to take control of your health. Today, we're going to be talking about the early signs of cognitive decline and how to prevent that, how to stay as mentally sharp for as long as possible using some pretty fun strategies. I'm joined here with esteemed Colin Renaud, a functional medicine PA. Colin, why don't you give a little background on kind of, your experience, how you got into functional medicine for those who may not know you?
Sure. Yeah. Thanks, Cole. I'm glad to be here. I'm one of the lead clinicians at MedMatrix. I have a pretty unique background. I have a background in chiropractic medicine, also in natural medicine. I practice medicine at MedMatrix as a PA. I'm multiple board certified as well as fellowship trained in functional medicine. So I've been doing this a little over 10 years now. Between all of us in the clinic, I think we have like over 50 years experience in functional medicine. So it's a pretty cool group of people from a clinician perspective. But yeah, I specialize in hormone health, weight loss, longevity, gut issues, thyroid, pretty much a lot of things that people struggle with, complex chronic illness. So talking about cognitive decline is something I deal with almost every day with patients. So I think it's a really good topic for us today.
Yeah, 100%. Cognitive decline is like one of those things too, right? Like is like one of the most important parts of your health, right? Like if you're physically not there, or I guess if you're physically there, but you're not mentally there anymore, it doesn't really matter. So cognitive health almost comes above everything when it comes to what's important, right? So quick disclaimer before we get into kind of the nitty gritty today is none of this is medical advice. This is really for this webinar. The podcast is for educational purposes only. If you want medical advice, you're welcome to enroll as a patient with MedMatrix. If you're interested in doing that, you can go to our website, medmatrixusa.com, and just click apply and talk to a patient coordinator. And this episode. So why don't you give us like a background, Colin? Like, what causes cognitive decline? Is it like one thing? Is it a bunch of things? Like what causes it?
It's often a bunch of things. And I think what we need to kind of address too is what is cognitive decline, kind of like what that means. So a lot of times I think people think of cognitive decline as older individuals, like the geriatric population, and also thinking about cognitive decline as people that may have neurocognitive disease like Alzheimer's, dementia, Parkinson's disease. So cognitive decline is really linked to a lot of different things, from poor sleep, chronic stress, uncontrolled diabetes, or even pre-diabetes, blood sugar irregularity. So there are a lot of root causes, but a lot of people kind of think that cognitive decline is really something that, like I said, shows up later in life, but there's a lot of early signs of this. So I think I think talking about this in the podcast is going to be important so people can understand what that is. But yeah, a lot of the things we see as cognitive decline are really systemic issues that go on for many years. Lack of sleep, really chronic stressful environments, people that struggle with hormonal deficiency or hormonal decline, also blood sugar regularity. Like I said, if you're pre-diabetic or have metabolic syndrome, a lot of issues there we see as related to cognitive issues for sure.
Interesting. Let's dive into like some of those things you mentioned, because you mentioned a lot that goes into like that can affect cognitive decline. One of the things you said was blood sugar and diabetes. So how does blood sugar and when you say blood sugar, is this like everyone? Like, is this something that only applies to like diabetics, or is this like most people are gonna like what? Like, let's talk a little bit more about that. Like, how does blood sugar affect cognitive decline?
Well, so everybody has blood sugar, right? You have blood glucose. And when people have sort of blood sugar irregularity, or if we want to call it insulin resistance, or the body's inability to control the blood sugar, which could lead to a pre-diabetes or a diabetes. A lot of that is dietary, poor lifestyle, eating the wrong food. So blood sugar dysregulation really affects the way the brain is fueled, because we really need blood sugar as energy for our brain. And when there's dysregulation and dysfunction there, it can affect the way the brain functions. So in theory, what you're dealing with is a dysfunctional brain in relation to sort of the food of the brain, right? So if you're not feeding the brain in the appropriate way, then it's not going to function correctly, which could affect things like neurotransmitters, which are the chemicals in the brain that make you feel good and make you happy. And And then there's also blood sugar that can affect inflammation in the brain. So someone that has insulin resistance or prediabetes or blood sugar regularity, it's a very inflammatory problem in the body. So that type of process, that inflammation, can affect the brain tissue directly. So if you think about, say, you fall and bust up your knee, right, or something, and it's red, it's inflamed, people know what inflammation is kind of on the outside, because if they, like I said, bump something, you have a sports injury, what that feels like. So think about that same kind of physical change on, say, your skin or something from an acute injury in the brain, right? If there's that inflammatory process, that swelling in the brain, it's going to not function well. So something like blood sugar irregularity over, say, X number of years, decades in a person, that causes low levels of inflammation in the brain, causing very slow potential neurocognitive decline. So we often, and we've said this on the podcast many times, that what you do today in whatever age you are will affect who you become in, say, 20, 30 years. So people that struggle with poor sleep, chronic stress, pre-diabetes now, maybe their 30s, 40s, 50s, say when they're 70, 80, that's when those issues of their younger years will affect them in older years. So we often talk about neurocognitive change as starting 20 to 30 years earlier than it actually appears. And that's one of the main reasons why we see this blood sugar regularity, inflammation. Yeah.
Okay.
So,
wow.
Yeah.
Yeah, because a lot of people think cognitive decline is something that just shows up later in life, but you're saying that it can actually start showing up a lot earlier. So what are like some signs that you might see in, like, your like 30, 40, 50-year-old patients who might be kind of exposed to early cognitive decline? Like how might that be showing up now, if that makes sense?
So some of the most common early signs people might already experience with cognitive decline that they brush off as sort of quote unquote normal is a lot of people have brain fog, but that's a really tricky symptom, I'll be honest, because brain fog can be a lot of things. And a lot of people have brain fog that might be normal because they just work in life. So there's also sort of a slower level of thinking. People aren't as quick. I have a lot of patients that will say, I'm not as like sharp. I can't like kind of bring it out really quickly. Forgetting names, forgetting words. It's on the tip of my tongue kind of sensation. Like I know what I want to say, but I can't say it.
Yeah.
And then also people that struggle with multitasking issues or difficulty with focus. We just had a great podcast last week with my colleague, Dr. Rose, about ADHD and how that kind of affects things. And so many of us are kind of ADHD now because of all their technology and phones, but difficulty focusing over a long-term period is another sign. Losing your train of thought sort of in, say, a mid-sentence or mid-task. People will often complain to me about their work is being impacted. I have presentations I have to do for work and I struggle with that, or I have tasks and projects that I'm struggling to get done. And then some people will talk about a decrease in their creativity or their logic or their reasoning. So the thing that we try to stress is some of these symptoms are normal for people, as just, we get tired, right? Life is tough. We all work and we have busy lives. So your brain gets tired. But what we're trying to really convey to people from a neurocognitive perspective is this is stuff that's going on long term. This isn't necessarily isolated instances. And it's not necessarily a normal thing if it's something that's prolonged over time, or it's progressively worsening, or you're just not able to kind of catch up with yourself mentally. So that's how we try to educate patients on some of these symptoms.
Great. Yeah. So a lot of the things you said was really interesting. You talked about like feeling like not as creative or not as sharp, or words, getting stuck at the tip of your tongue, which is interesting. I want to make a point here. It's like, like if you went to your maybe normal doctor with like kind of some of those issues, they might be like, okay, and like,
right.
Like they might not look at like that might not actually, like, they probably wouldn't care too much about like that as an issue. Right. Can you kind of talk about the contrast between like how like functional medicine looks at like things like that opposed to like how conventional medicine, like in that contrast?
Yeah, I think it's really important to highlight from a functional medicine perspective, aging and cognitive decline, because as functional medicine practitioners, especially me, and I know my colleagues too at MedMatrix, we look at things from a way of optimization and longevity, right? We're trying to live as long as we can, as healthy as we can, as prosperous as and optimal as we can, physically and mentally.
Right.
When you introduce a concern in the sort of standard medical model of care, not that this is good or bad, I'm just kind of making a point. A lot of it, depending on your age, is, well, you're just getting older, quote unquote, or you have a lot of stress, or, well, like, for example, a couple days ago, I had a patient, a female. She was in her mid 40s. She has a few young kids, and she was kind of experiencing some of this. Is it cognitive decline? Not sure, but she's having some brain fog and just feeling tired mentally. And her primary care doctor was like, well, you have 3 kids, so of course you're going to be tired, right? It's sort of, I feel like with instances like this, especially cognitive stuff or feeling tired mentally, if you're not 70, right, which would sort of trigger a neurocognitive exam to kind of understand if you do have something like an Alzheimer's or dementia. If you're saying your 40s or even 50s, you're maybe too young for neurocognitive disease. So your doctors might sort of push that aside as trying to come up with a reason. Well, you work a lot, or you have kids, or you're getting older.
Mm-hmm.
Okay, that's not really an answer. And so many of my patients that struggle with brain fog or cognitive dysfunction or issues with word capture or memory, they're told like, oh, well, you're in your 40s now, like it's just happens.
Right.
I just feel like it's so ridiculous, right? That the
Mm-hmm.
medical community at large, not everybody, I'm not saying that, but as a whole, sort of puts in people's ear that it's normal to feel the effects of aging in your 30s and 40s.
Mm-hmm. Yeah.
And if you think about that, right, if we sort of stop and think, and this is what patients are starting to do, and this is where functional medicine is coming in and sort of filling in the gaps, people aren't accepting that anymore. They're coming to us and saying, well, I saw my doctor. I'm having a lot of brain fog. I'm just not thinking well. I'm not performing at work. They tell me I'm getting older, and I just don't accept that.
Mm-hmm.
So that's where we come in. That's the functional medicine advantage. And we say, yes, I don't accept that either for you. What can we start to look for that
Mm-hmm.
will be driving this to fruition? And that's really the difference, is trying to be proactive about this versus just trying to come up with a random solution to what the medical community thinks is a non-problem, but is actually a problem. Yeah.
Okay. Yeah. Great.
Yeah.
So now, like, what does that actually look like? Like, how does that look differently from a, like what you're actually doing inside your practice? Like, patient comes in and they're like saying, hey, I have brain fog. Like, I don't feel creative. I'm not as motivated anymore. Like, what are some of the things that like you actually start to look at and questions you start to ask to actually like, make change?
We ask a lot of questions when we're evaluating a patient for any condition, including cognitive issues. And that's just the functional medicine sort of way, because we're trying to identify what sort of lifestyle variables are affecting things. We're trying to understand what dietary effects are having on people. We're asking about people's stress, about their job, about their situation, right? Are you married? Do you have kids? How are you sleeping? That's a big thing. We've talked about sleep on the podcast so much. And if people aren't sleeping, or, yeah, I sleep 3 hours a night, been that way for years, it's sort of like a hard stop right there. How can we expect your brain to work if you don't sleep?
Yeah.
So we start to look at some of these lifestyle pieces from a patient and all these variables. And then we really dive deep into the biomarkers, the objective, right? The blood sugar, like we talked about, the nutrition markers, the inflammatory markers, the hormone markers. And you start to paint a picture of, okay, this patient's not sleeping. They're not eating well. They've got a really stressful job. They're vitamin D deficient. They're vitamin B12 deficient. They're maybe perimenopausal or low testosterone. You put all this together in this little soup, right? This puzzle, and that's the functional medicine advantage, is putting this all together. And then it's sort of presenting it back to the patient to say, well, of course you don't feel good. How would you? All these things are going on. So that's really the way we excel at MedMatrix from a functional medicine perspective, is putting together all those pieces that are not investigated otherwise. for most patients, because those are really the important things. And if people, like I said, if people aren't doing some of the basics like diet, sleep, their stress is to the max, you sort of have to have a hard stop. And I get kind of real with people, and it's a little tough love, and to say, listen, we have to improve these big variables, or it's going to be really hard to get you better. If you're not eating, if you're not sleeping. So yeah. Versus say, in the conventional medical setting, there might be a similar conversation. And a patient might tell their doctor, yeah, I'm not sleeping. And the doctor rightfully will say, oh, well, that's a huge problem. Here's a sleeping pill. Again, I'm not faulting that, not saying it's good or bad, but has it solved a problem? I'm not sure it has, right? For a long-term solution anyway.
Okay. So sleep has kept coming up as far as like, it seems like one of the most important things in cognitive decline. And I know just like I hear from a lot of patients, and a lot of them come to us because they're not sleeping well, or they're coming to us and then you later find out like that they're not sleeping well. So, just curious, actually, how many of new patients that are coming to Med Matrix are not sleeping well when they first come to us?
Well, I'm just one of a few of our clinicians in the practice, so I'll speak for them because we talk all the time, and I sort of know what our patient population looks like. But the number of people that don't sleep that come into our practice are a good amount. I would say, as a new patient, I would say almost, I would say more don't sleep well than actually do. I don't know what the percentage is necessarily. It's definitely at least 75%. 3/4 of my new patients are having some level of sleep disturbance. And whether that is related to, say in females that are perimenopausal or menopausal, where their hormones have started to shift, decline in certain sex hormones in women can significantly affect sleep.
Yeah.
Also, sex hormones in men, if your testosterone is low, it will affect your sleep. So there's definitely a good number. I don't have too many that are like, yeah, I sleep great and everything's fine. That doesn't happen very often.
Yeah, so, right. Especially when they first come in. So why is sleep so important and so closely tied to like cognitive health and like cognitive decline if you're not sleeping well?
Sleep is so important when it comes to cognitive decline and the impact over time really on cognitive decline, because when you sleep very deeply, your brain detoxifies. We call it the glymphatic system. People have probably heard of lymphatic system. It's sort of the body's waste plumbing to get rid of waste and toxin. You have a similar system in your brain, but it's specific to the brain and the way it functions physiologically. So when you are in deep sleep, your brain is almost like going through the rinse cycle in the dishwasher or like your washing machine, right? Put your brain in the washing machine overnight and kind of rinse away all the toxins of the day and everything that's been going on. If you're not sleeping, then your brain is not cleaning itself. So, we do things for our bodies every day to clean ourselves, right? We shower, we bathe, we brush our teeth, we wash our hair, we do things to clean our bodies. But no one thinks about, well, how do I clean my brain or other parts of my body? And sleep is how we clean our brain. So you can have issues with memory because when you sleep, memory consolidation occurs. Sleep deprivation over a long period of time can lead to poor focus and brain fog. And also, we talked about inflammation a little bit earlier. Poor sleep or lack of sleep is a significant driver of inflammation in the brain. So you can get a lot of toxin buildup. And people we live in a world, especially in the United States. I mean, culture is different across the world in terms of how we take care of ourselves as humans. But in the US, for the most part, depending on maybe where you live, this drive to do and go at a very high level is sort of a cultural part of a good amount of people in this country anyway. So there are people, especially depending on the type of work they do or their lifestyle, that I've seen as patients that feel that they just can hack the sleep part. Like, I don't need sleep, or I have 3 businesses that I run and I'm responsible for XYZ and I've never slept a lot because I have a lot to do. And they just sort of think that they can push through. And then these are the people that are doing this kind of hacking on their body in their 30s, 40s, 50s. they're the ones that in their 60s and 70s will end up as Alzheimer's dementia patients, because they sort of try to skate by hacking the body in a bad way and not giving it what it needed. So that's really where we see the decline. And it's our job in the functional medicine clinic, like MedMatrix, to educate people to say, whoa, you got to stop, right? You're on the road to destruction if you continue to do this. That's part of our job as educators. So sleep's a big one for everybody.
Yeah.
And it's something we discuss right from the beginning. When you become a new patient in the clinic, we talk about sleep. All the clinicians talk about it. It's one of the most important parts of our intake, is talking about that lifestyle factor.
Yeah. What's like the what would you say, like the minimal amount of sleep that you would need to get to like be kind of in the clear of like, or at least not encouraging cognitive decline, if that makes sense?
Yeah. The research said your age and to 9 hours. The thing about sleep really is you really need the deep sleep. So if you're not getting deep sleep, so if you're not sleeping enough, you're not going to get the deep sleep that you need. So if you're sleeping, say, 4 hours a night or something, the amount of deep sleep is going to be highly reduced. So I'm pretty sure deep sleep, you need like 2 to 3 hours. I'd have to look up the data, but it's a few hours at least of deep sleep. So that's why you need like 7 to 9 hours of sleep to achieve that number of deep sleep, because your sleep cycle goes through different you go through different phases of sleep. It's not all deep sleep that when you're sleeping. So it's younger people, adolescents, need more sleep because of their brains, and their brain is growing and all of that stuff. So
yeah,
there's a lot of sleep that's needed for people.
What do you think has a bigger impact on kind of like neuro health, brain health, and preventing cognitive decline, sleep or nutrition or stress?
Oh gosh. Oh. What's the bigger of the three? That's a really hard question, Cole. Chronic stress really affects the body, and it really affects the brain.
Let's talk about that. How does chronic stress affect the brain?
Yeah.
And then let's define chronic stress, for example. Like I work a lot. I'm also training for like an Ironman. Is that chronic stress, or is that like healthy stress? Like, let's talk about that.
Stress is really subjective, right, to a person. And I think there's an amount of stress that people put themselves through that is very healthy, as you said. Like there are healthy stressors, right? Like I work out, I do bodybuilding, right? You're training for an Ironman. Physical exertion is very healthy stress on the body. But I think people can very easily identify when their stress levels are unhealthy, because they lose the ability to understand how to like make it work for them. They are kind of, as we say, burning the candle at both ends.
Yeah.
Right. They're not able to function. Their lives are starting to be impacted. They're lacking the ability for self-care. They're lacking the ability for proper.
Colin, you there? If you're joining us live, let us know if you're having these tech issues, or if you're hearing Colin clearly, or if I'm the issue, because right now Colin has disappeared. Oh, there he is. Leah, who is our back-end person, is working on it. Oh,
hi guys. We've notified him that he's lagging on our end, and we're just going to try and fix that. So once he pops back in, we will re-add him.
All right, and we're back.
Sorry, I don't know what happened.
Little intermission. I hope everyone was able. I think we were talking about stress and how that affects cognitive decline.
Yeah. Sorry, everybody that's listening live. I don't know what happened. As I was saying, I think it's really hard to kind of piece apart like a chronic stress, a food, a sleep issue, because they kind of all go together. I think chronic stress can sometimes be an overlying issue for people when it comes to some of these other lifestyle things, because when you're living a lifestyle that is not in line with taking care of yourself well, if you're not giving the time for sleep, for proper nutrition, then those other things are going to suffer. So like a perfect example of that, I think, is I hear from patients all the time is, well, I don't eat well because I don't have time. Well, okay, why don't you have time? Well, kids, I'm at work all the time. I don't have time to meal prep. I know I should, but like I just, So life, whatever we want to call that variable, stress, whatever responsibility, life for people starts to accumulate in such a way where they start to neglect these basic self-care tasks. And then sleep starts to go. Right? I'm not sleeping as well. I'm not sleeping less. And then I start to eat and less. And then, the stress gets higher and you try to push yourself, right? Take on more job responsibilities, take on another job, take on more of this, more of that. And it's like I said, these people that are trying to perform at a very high level, and there's performing at a very high level, but then there's kind of tipping over the edge and you're just kind of, falling without a parachute. So those are the people that we see a lot in the clinic at MedMatrix is you've kind of gone over the edge and you don't know how to come back from it. And they're brain foggy. They're not performing at work and they really don't know. They know they need to reel it in, but they don't know how.
What are some of your favorite, I guess question A, are there any like specific like blood markers or tests that you can like subjectively run and say like, okay, like we can see this on like your blood work that this is happening? And then also like if either way, like what are some of your favorite strategies to like get people back on track?
Well, blood markers are a lot. We see inflammation markers, we see nutritional deficiencies, we see effects on the thyroid. We can start to see blood sugar regularity. All those types of tests we run in the initial panel for patients when they join as a new patient at MedMatrix. But we do see a lot of this stuff objectively. And I think this is where it starts to hone in for people is they know they need to do better, but then they come to us and we sort of lay it all out on paper. It's like, yeah, it's there. You're pre-diabetic or you're even diabetic. You're nutritionally deficient. Your cortisol is really high, which is a stress hormone, or it's really low. Your inflammation markers are high. So we sort of can see this objectively, but some of my favorite sort of approaches for getting this kind of back on track is it sometimes take a little bit of tough love. I don't know how to say it any better, but it's really hard for me as a clinician to, and I know my colleagues at MedMatrix will agree with me, it's hard for us as functional medicine providers to have patients be disconnected from themselves or disconnected from their care. We're not, gonna just give pills for people to sleep better or, pills to just, magically improve everything. It's really, you really have to be responsible and proactive about your health. So patients that join the clinic as new patients really need to understand that their health is really driven by their proactiveness. And that's a big thing we talk about in the initial stage of care. That's a big thing for me is like, listen, you've got to make some change. We've got to change your diet. We've got to change the way you live. We've got to change your sleeping habits. And it's not an overnight thing, but it's recognizing it from a patient's perspective that you have to do these things or it's not going to really work. So that's how we get started. That's how it has to happen. Yeah.
Just one step after another, right?
Yeah. Yeah. Sort of one foot in front of the other. And a lot of patients are just ready for a change and they know they need to do it, but they don't know where to start. And that's totally fine. That's what our job is to lay it all out for them and say, listen, this is how we're going to start. And I'm here to be your accountability buddy and help you through it. So you know how to start.
Yeah. But it sounds like it's a lot of just the simple. Colin, you there?
Oh, yeah, I'm here. You broke up for a second there, Cole. I don't know.
I was just saying it's just a lot of the simple things. It's kind of what you were
simple things.
Saying. Yeah. And I think a lot of the patients, patients also do love the kind of more fancy things we can do. So like, what are some of those things when it comes to like tools that like can also help patients that you like to use, whether it's supplements or even things like peptides or other like hormones? Like what are some of the other tools that are very helpful?
We use a lot of tools. From a functional medicine perspective at MedMatrix, we have so many tools. I often talk about, the overuse of medication, just because that's a sort of standard medical practice is when you have a problem, you just get medicated for it. But we are not anti-medicine at MedMatrix. I want to make that very clear. We do prescribe medication that's appropriate, but we're often prescribing things in a different way. could be medication in a different form or different doses of things, but often using other types of medication as like hormone replacement, for example. That's a medication, but it is something that is used much more routinely in sort of a functional medicine space. So something like that is really important. Using a lot of supplements, using a lot of herbs, botanical medicines, IV therapy, we do in the clinic. Some people are just dry, they're dehydrated, or they're nutritionally deficient. All right, come in and get a B12 shot, come in and get a shot of vitamin D, come in and get an IV, right, of some B vitamins, some nutrients, just something to kind of like boost you up and kind of get the blood flowing and get your brain turned on. Peptides are a great thing. As you mentioned, we use a lot of peptides in the practice that can target energy and mitochondrial support and things like regenerative and reparative processes. So there's a lot of tools we use, and the tools are to be used. It's almost like a 50-50, right? The patient has to meet us halfway and we'll meet them halfway. So we can give sort of our stuff, all of our tools, but as long as you're meeting us too in the middle. We can't give everything and you do nothing, right? You have to do some change. You have to make some dietary change, some lifestyle. We help you do that. We teach you how, but it's a 50-50 relationship. It's a synergism that helps people relearn how to basically live their life using the tools. So
that's great.
Yeah, it's cool.
Let's talk more about that, because there's a lot of like fluff out there. I mean, you go on Instagram nowadays and it's like every other ad's like the new supplement is gonna like fix all your problems. So like, what are some of like the most important? You mentioned nutrients, you talked about nutrition, you mentioned supplements. So what are some of your favorite like supplements when it comes to like staying mentally sharp, nutrients that are important to kind of like monitor?
One of the most common things I see for people that have cognitive decline or chronic fatigue or brain fog from a nutrition perspective is being deficient in vitamin D.
Really?
Vitamin D is really, really important for your for fatigue, for brain function, also immune system function. But I've had people with vitamin D totally in the toilet. And obviously that's not necessarily the only intervention we make, but something like that is really simple. Come into the clinic and get a shot of vitamin D, start on a really high dose quality supplement, and give it a couple weeks. And people are their brain just kind of turns right back on. I've had people that have vitamin D really, really deficient. I get them in the clinic. They do a shot of, say, a high dose of vitamin D as an injection. And right away, oh, I'm just like, I slept so good last night kind of thing. Or I was like so sharp that next day. So it's sometimes really basic. And sometimes it sort of surprises us because like, how did you go so long without knowing this? No one checked this. But people don't. So that's what we do. But yeah, really basic stuff, basic B vitamins, things like magnesium people are deficient in. Because again, this can come from poor diet, right? You're just not eating, or you're eating one meal a day because you're stressed to the max and you don't have time. So your basic nutritional markers and your basic nutrients and vitamins are low. We see that on labs, and that's sometimes where we start in combination with maybe some other things. But it's like, you got to get these nutrients better in order to start improving things. So those are some really basic stuff. There are also certain herbs that we use that can help regulate like your stress hormones, that can help regulate sort of your sleep cycle, your sleep rhythm. We use herbs like things called adaptogens that can help with regulating your cortisol and your stress response. So there are a lot of really cool things that we do. And this is all training that we've all had. This is not stuff they teach in medical school or any type of conventional medical training. This is all stuff we've learned. I took classes and seminars and read books and became board certified and all these other things. So these are things you just don't get in the traditional medical sense. And the other thing I want to make note of is all these interventions that we're using for cognition or sleep improvement or whatever it is, they're all heavily studied, heavily researched. We pride ourselves at MedMatrix on practicing evidence-based medicine. So it's not something that we're just pulling out of the clouds. This is all stuff that is heavily researched and heavily understood from a medical perspective that's appropriate for people. So
great. Yeah.
But those are some things we do just really routinely. Some of the basics is the best way to start. Yeah.
Yeah, I think that's, I mean, go a little off topic here, but I think that's a really good point to bring up, that it is evidence-based. I think
Yeah.
there's so many like functional medicine, holistic medicine, natural medicine, right? There, and there's longevity medicine. There's all these different terms, and not a lot of people like know what it actually is. So sometimes people think it's kind of like woo woo, but in reality, it's like functional medicine is evidence based as it gets, right?
Yeah. Yeah.
Yeah.
It's a great actually idea for a podcast maybe in the future, is kind of defining some of these terms, what they
Yeah.
mean, how we use them, you
Mhm.
know, what they mean for patients, what they mean for clinicians.
Yeah.
Yeah, it might be a great discussion to have so people understand it a little bit better. Because you're right, there's all these kind of terms, and they're kind of sexy, right, for
Yeah.
people to use. It's very buzzy. It's social media drives this a lot, but what does
Yeah.
it actually mean? Yeah, it's a
Mhm.
good point.
Yeah, and it's also kind of different, right? Because it's like, you go to a cardiologist, like you kind of know what you're going to get, right? But if you go to a functional
Yep.
medicine practice, it's like literally every single one's going to be a different experience.
Hmm.
So it's
Yeah.
like, you got to make sure who you're working with is legit.
Yeah.
But okay, yeah. So real quick, you also talked about peptides. I know a lot of people are interested in peptides, and then you mentioned
Yeah.
specifically peptides that work on the mitochondria. So let's
Hmm.
unpack that a little bit. So first off, like in simple terms, like what is the mitochondria? How does that affect brain
Yeah.
health? And then like we'll dive into like peptides and like how they can improve mitochondria function.
So mitochondria is a part of the cell. So the very basic building blocks of all your tissues. The mitochondria is where energy molecules are made.
Hmm.
So specifically something called ATP.
Mm.
Probably people might be like, oh yeah, I remember that from high school biology or something.
Yeah.
But basically this is a very reductionist way of how your body sort of energizes itself. So when people struggle with a variety of issues, whether it's complex chronic health issues, chronic fatigue syndrome, chronic stress, you name it. There could be some level of mitochondrial dysfunction. So basically, at a cellular level, your body's cells are not able to produce the energy that it needs to function. So if you're trying really hard to do your day to day, and your energy cells are not making energy, it's going to be really hard for you to do that. So when we talk about mitochondria, we really are talking about, as I said, how the body fuels itself. So if people are struggling with brain fog, cognitive dysfunction, or just cognitive decline in general, mitochondrial support is always something we want to think about, because if the brain is not making energy, not able to utilize energy, from a basic physiological cellular perspective, that's a problem.
Hmm.
Um, so there are various ways to kind of test for that. We don't always do that because it can be kind of costly, and it doesn't always change the treatment plan. But there are ways that we can try to approach mitochondrial dysfunction using certain peptides, using certain herbs, botanical medicine supplements, to try to help kind of turn on that energy production factory that's in all of your cells.
Hmm.
So very, very important to address for almost every patient, because when people are tired mentally, physically, cognitively, it's probably very safe to assume there's some level of mitochondrial dysfunction.
Interesting. Okay, and
Yeah.
then talk about, so like what are like some of like the mitochondrial peptides and how do they work?
So one of the most common ones that I like, is something called MOTS-c. And again, I'm not providing medical advice for anybody, so this is just educational. But MOTS-c is a peptide that directly affects metabolic health.
Hmm.
So it can specifically target insulin resistance, which we talked about a little bit earlier, and regulate your blood sugar. There is some studies that show that MOTS-c actually improves physical capacity, endurance, and then sort of your lifespan. So it kind of um, almost doesn't mimic exercise, but it sort of improves how much capacity you have for exercise. And then there's a lot of new research on MOTS-c about how it can protect the cells from oxidative stress. So specifically, what that means is the cells get damaged from physical stressors. So this can lead to metabolic decline and age-related decline. So there's like a
Yeah.
longevity piece to this too. But There are other peptides that we use for energy, but this one I do love a lot because it sort of acts as like a master switch for the metabolism. So it's pretty cool.
Yeah.
There's certain herbs that can be used to power energy. Something like NAD is really common, or the precursors to NAD, which is NR and NMN.
Yeah.
There are a lot of different cool things that we use. So, and the thing you mentioned this earlier, Cole, which was really really cool, but you talked about sort of how all this stuff is being advertised sort of in social media, and it's kind of all over the wavelengths of Instagram and all of our social media platforms. So people do try to sell these things, for patients. Companies are trying to promote all these supplements and, for your energy and blah, blah, blah. They're great. They do work. But I want to make it clear that if people are struggling, right, and we think there's mitochondrial dysfunction, we think that there's energy issues, people are struggling physically, mentally, cognitively, taking a supplement to improve that without addressing all the other underlying baseline issues is going to be hard for you to get better. And that's where these, influencers on Instagram or TikTok or these big supplement companies, they'll make a ton of money because they're selling you this pill that will help with energy. Technically, right? The ingredient has been proven to do that. But again, people aren't eating well, they're not sleeping, they're nutritionally deficient, all that stuff. If that's not improved as part of the treatment plan, you could unload all the peptides and supplements in the world. It's not going to make a huge difference. You have to use these things in conjunction with those other pieces. So that goes back to my comment earlier to say, like, it's a 50-50. Or if the patient's not doing their role and we're not doing it equally, it's not going to work. So you have to satisfy those basic things for patients to start being able to use some of these other tools successfully.
Yeah. Okay.
Yeah. It's really important. Yeah.
Yeah. One tool that I don't think we've mentioned yet, but it's like everyone knows it as like the brain supplement is omega 3 and 6. Can you talk a little bit about that? Like how like if you take your omega 3s every day, like are you not going to get Alzheimer's 100%? Like what's the real about omega?
So it's not that simple because there's a lot of different, it's very multifactorial in terms of how something like an Alzheimer's develops. But omega-3 fatty acids, particularly DHA and EPA, I'm sure maybe people have seen those on their supplements or online or something, but they're really crucial for brain health. So basically they support the cell membrane. So the cell we talked about has this like outer wall that holds everything in the cell, and it's made of these fatty acids. So if you don't have enough fatty acids in your diet, then it can be really hard for your cells to kind of turn over and make new cells because the raw materials are not there. So they really, really importantly support the cell membrane. They importantly improve neuronal communication, or how the nerves communicate with each other. So your brain is just this collection of all these different nerves together. And without enough fatty acids, they can't connect and make connection and transmit messages and things like that. So that's a really important part. And then also omega-3s have very potent anti-inflammatory properties. So we talked about this earlier, where inflammation can directly affect the brain, like physically, how it works. So omega-3s can have an anti-inflammatory effect. But again, if you're trying to supplement omega-3s on top of a really bad diet, it's not going to work. So you've got to start doing that work plus doing the supplementation. But I use omega-3s and probably almost everybody. It has a lot of benefit, not just cognitively.
Yeah. And this is kind of an odd question, but like how important is like consistency in all of this? Because like I know a lot of people like they try to do on their own. Like they'll take their stuff, they'll buy omegas, they'll take the bottle, they'll like take good sleep for a couple weeks, but then it's like, okay, and then another week goes by, and then they're drinking on weekends, and then like not sleeping well, and then like they didn't reorder their supplements. So like how important is consistency in all of this?
Consistency, and this is probably another great podcast episode topic, but consistency is extremely important for patients to get better, because if you think about how long it took the patient to feel unwell, it wasn't overnight for almost a lot of people that struggle with chronic health issues. So
Yeah.
to expect themselves to get better in a week is not going to work. So when I talk to patients, especially in the beginning phases of care, I try really hard with everybody to be very transparent about their expectations, to say, listen, this can take 6 months, this can take a year, if not longer. And that's why it's really important for them to understand that the 50-50 relationship is so important. So these are the things I'm going to do, right? As the clinician, these are the things I need you to do. And we're going to talk every few weeks, every few months, whatever that is, to start checking in on each other and holding each other accountable. So the consistency is extremely important for anything, right? You go to the gym once, you're not going to notice a change. You go to the gym twice or a week, you won't notice a change. After 6 months, you'll notice a change, right? After a year, you'll notice a change. You're probably experiencing this with your Ironman training, right? You do it once, nothing's going to happen. It's just like learning a new task, right? You do it once, you're not any better at it. You've got to do it over and over again. So we educate patients all the time that this is really a change in the way you live, the way you function, the way you exist in your space, your home, your job, your relationships, your family. And it just has to be that way. And if people aren't ready for that, that's fine, totally fine. But that's really what it needs to come down to. So we do that so well at MedMatrix from a functional medicine perspective, because we understand how to guide people through. Where I think the traditional medical community just doesn't know how to hold patients accountable and how to bring them through a treatment period over a period of time to change their life. So
that's a great point.
Consistency is so important.
I mean, it's kind of like obvious, like you're kind of like, well, duh, right? But like, the reality is like, it actually, like, doing all these things, like taking the right supplements, consistently eating well, consistently getting good sleep, exercising, like in the midst of like, your job, your family, like social life, like it actually is really hard. And like, that's one of the reasons, like, I love like because I'm obviously, I work at MedMatrix, but I'm also a patient. Like it's like, you kind of get regimented. Like you go in, it's like, 2 hours every 3 months, like you spend on labs and a provider visit. And then you got like your provider assistant who just takes care of like making sure all your supplements arrive at your door. And if you're doing any medications, like those show up, you get like, nutrition, lifestyle plans. And it just makes like the consistency very easy. Cause like, honestly, to like stay on top of all those things, like is challenging. Right. And I think like a lot of people, like they want to do the right thing. They try to do the right thing on their own, but they don't, it's just like the follow through that's kind of the hard part. All right. So
really hard.
So we're getting to the 50-minute mark. So we're going to go through we're going to do a patient case study, and then we're going to start doing some Q&A. So looks like we've had a pretty small but fantastic crowd with us today. We have like 15, 20 people like kind of sticking around the whole time. So drop some comments, guys, and like questions you have, clarification you want on certain things we've talked about, and we'll answer those live. Don't leave us hanging here. And then while we wait for you guys to do some comments, let's do a patient case study, which is something fun we always do. So, Colin, if you could like think of a patient that like specifically relates to just like cognitive decline or brain fog that kind of came in, and like what you did with functional medicine.
Yeah, and for me, it was pretty straightforward, but not straightforward in any way for the patient, I don't think, because they didn't understand the connections. But this was a patient I saw probably 6 months ago, 5 months ago, maybe. And Cole, your video dropped off. I don't know if you can still hear me.
Keep going. I'll figure it
out. So patient I saw about 6 months ago came in, and he already had been diagnosed with diabetes. So he was on multiple medications for his diabetes, and his diabetic markers were not able to get better. So his primary care doctor was sort of on him all the time. We got to increase your medicine. We got to increase. And he was just kind of done. Like, I don't want to keep increasing my medication. I don't want to keep, you're just not offering me any type of resolve. So he wanted help from me, sort of like, okay, what do you think? I've had diabetes for 20 years. I can't get it better, and he was doing all the right things. He was exercising. His diet was not that bad. There's always ways to tweak diet, but it wasn't a traditional, like, I eat like crap kind of person. He was on top of it. He was putting in the effort. So on top of managing his complex health concerns, one of his major chief concern was fatigue, just
Mm.
all over the place, physical, mental. And he works, I don't remember the exact title of his job, but he works in maritime work something. He's an engineer on some sort of maritime vessel, whatever that, I'm not sure some of the specifics, and forgive me if those listening are related to this. I don't know. I'm ignorant to that stuff, but he was starting to really have a decline in his ability to work because he had a very high cognitive function, a high level of function at his job as an engineer on this boat. So he was responsible for a lot of things, really struggling. When we did his intake and going through all of this stuff, and he was sleeping well, I mean, it was everything. Everything was not too bad, right? But it's cognitive decline, really, really bad cognitive decline. So when I educated him about it, it's like, okay, well, you have really bad cognitive decline, probably because you're diabetic. That's probably part of it. And he recognized that, but it's like, I'm doing all the right things from a diet and lifestyle perspective. Why is my diabetes so bad? And then if it's making my cognitive issues bad, right, it's sort of snowballing. He's 57, something like that. His testosterone was in the toilet, totally in the toilet. I think it was like 203 or something. So for those that know or know anything about hormones in men, testosterone is like 300 to 1200 in a normal range and should be about 700 to 900 optimally. His was like 201 or something.
Yeah.
So it's like, okay, your testosterone's really low. Testosterone in men is going to significantly impact cognition, number one. And there are studies that show men that do suffer from neurocognitive decline, like Alzheimer's, dementia, have low testosterone. There's a correlation there. Not necessarily saying that treating Alzheimer's and dementia is with testosterone, but there's a clinical correlation in the literature.
Yeah.
So his testosterone being low was affecting his mental ability and also his body's ability to regulate his blood sugar. After 6 months on testosterone replacement, he was as sharp as the tack at work, doing all the good things. And his blood sugar improved so much that I had to talk to his primary care doctor to say, hey, he's having hypoglycemia episodes or episodes of low blood sugar. We got to take him off of some of these meds. So he was on 3 medications to manage his diabetes. He went down to like 1 at a very low level within 6 months.
Yeah,
and
great.
It was really, really remarkable. So he was really happy about the diabetes. He was totally thrilled. He's like, you don't even know. I've been dealing with this diabetes thing for so long. Why didn't no one ever tell me this? And I was like, I don't know. But then just from a performance perspective, because like I said, he had a very high level performance job cognitively as an engineer. So getting that back in a few months was really life-changing. So really cool case, but it wasn't like a direct relation. It was like, okay, we have to figure out all the tools and the pieces to kind of link it together, but this is how functional medicine works, right? It's like you come in with a chief concern and we have to try to Sherlock Holmes it and say, how is this all related together? And we have to investigate and try to put the pieces together. So if he had never come to us, he may have succumbed to a neurocognitive disease in later life because of the diabetes being bad, it effect on the brain, the low testosterone's effect on the brain after a while. I'm not saying he won't, but it's much more unlikely now that he'll have neurocognitive decline when he's, say, 70 or 80 years old. So it was a really cool case, but not something that is overly visible, say, in the medical community, not as recognized as linked together. So really cool guy.
Yeah, that's still so exciting, man. That must feel really cool for you too, just as a provider to like be able to help people like that. I mean, that's so fulfilling. I'm like so happy to, like, it's awesome to hear all the time.
It becomes sort of second nature to us as functional clinicians because this is just the way our brain works. So when we do this stuff, I do it all day, right? Day after day, hour after hour, I see patients all the time. And, it's tons of positive stories and life-changing stories. And sometimes I do, and I'm not trying to say this to toot my horn. That's not what we do, that we don't have egos as clinicians at MedMatrix, but we sort of get lost in the fact that we do this routinely because patients come in and they'll say, what, like this guy, I've had diabetes for like 15 years. Why has no one told me that I should have my testosterone optimized? I'm like, dude, I couldn't tell you. And he's like, yeah, but you sat with me for literally 30 minutes, went through labs and said, this is your problem. I've been to multiple specialists over 15 years. How does no one? And it's like, I don't know, but it's just like, it's almost like I brush my teeth every day and I, do all these things routinely. It's just such a routine part of how we treat people. And we forget that this is not the norm.
Yeah.
We forget all the time. So we have to kind of reel ourselves back in and say, people are not used to this type of healthcare, but we do it so routinely every day. So it is really cool, really rewarding.
Yeah, it is so exciting. Well, thanks for the story. That was great. I'm sure other people appreciated it. All right, guys, we got like 2 minutes here. And we got no questions. So you guys are kind of letting us down. I'm kind of sad.
Cole, be nice to the listeners. Maybe we've done such a good job. Yeah. I said this to Dr. Rose the other day on the podcast. We had no questions. I said, well, we just did a really good job.
That's a good way to look at it.
We answered everybody's questions. We were really insightful and really articulate. So we have nothing. There's nothing else to say.
Okay, well, at least give us like a thumbs up, guys. I need a little bit more reassurance than Colin here, but
gotta have confidence.
Yeah. All right. Well, if we don't get any questions here next minute, we'll wrap up. So yeah, I mean, if that was an awesome episode. That was so much fun. I learned a lot. If you're watching this live and you're interested with working with us as a patient, you can go to medmatrixusa.com and apply to become a patient there. There we go. We got one. Thank you, Kathleen. Thank you, Lynn.
Oh yeah, looking forward to more. Yeah, I'm a new patient. Just had blood work. Yeah, thanks, guys.
Excited to meet you, Kathleen. Thank you, Lynn. Appreciate it.
Yeah, we talk to each other, right, Cole? And we don't know, like, are people even listening to, so it's nice to hear. So I hear you.
Yeah. So
are we making sense?
Thank you, guys. So and to, share this with friends, like spread the word. It's like, again, like, Colin was talking about that guy who came in who could have like lived the rest of his life and like kind of suffering, not enjoying life. And health is so important. And that's what we try to do here. So that's it for today's episode. If you're interested in learning more, becoming a patient, you can go to medmatrixusa.com and get started there. Thank you, everyone.
Thanks, everyone.